All right. So basically, just the sort of goal of this interview is to get information about your experiences as a physician and particularly through the lens of global health. So we're really interested in your personal passions in the medical profession, as well as in your relationship with advocacy and with social justice.
Mhm.
So if you could just start off by kind of introducing yourself and sharing what sort of makes you care about and passionate about global health.
Sure. Well, my name is Rebecca McAteer, and I'm a family physician by training. I did my training in Lancaster General Hospital after completing a medical degree at New York Medical College here in Valhalla. And I have, you mentioned passions in the field of medicine, and I think as a family physician, I have many of them. It's sort of characteristic of the field that we tend to almost have ADD in terms of our professional interests, which is a good thing. So I spent a year as a fellow after my residency doing hospitalist work as well as medical humanities, and working a lot on using the arts as a lens, both for self reflection and maintenance of wellness and physician engagement, as well as to teach medical students and undergraduates and residents actually. So it was a faculty development fellowship, and then I went from there in Washington D.C. to Nepal, to Tansen, Nepal, which was a very different care setting in a lot of ways. And that was where I spent the next 2 years, just over 2 years, 27 months, doing very full spectrum global health care. I'd felt sort of a calling to do that. It was, to a very large extent rooted in my faith as a Christian, and also just, I think, getting a sense that there is so much injustice in the world and that I've been given so much, and I wanted to really be part of contributing to more equity insofar as I could. And so when I went to Nepal, I had to learn Nepali, so I didn't speak any Nepali at all. I didn't know the alphabet, and so I learned that as well, to read and write Nepali, as well as to speak it, and really experienced a very, again, a very different care setting from anything that I'd had. The sorts of pathology that you see, and you hear this a lot, I think, in global health, but the sort of pathology that you see in terms of the range as well as the extent of advanced disease is really remarkable. And so much of it was rooted in issues relating to access to care, poverty, nutrition, obviously, communicable diseases that are, preventable, vaccine preventable diseases, as well as tuberculosis and HIV and other tropical diseases like, leptospirosis, leishmaniasis, typhoid, a lot of that, meningitis, a lot of that stuff. So it was a very interesting experience to have to learn all these new diseases that I may have read about, for like a couple of sentences years earlier in med school, and you don't really have any exposure other than that. And I think to begin to see the various resources that go into a healthcare system, not even just the obvious things like having sufficient beds and medicines and laboratory techniques and that kind of thing, but the next level up would be medical training infrastructure, having a rigorous body that credentials training institutions and really ensures high standards of education so that bad practices don't get passed down. I was fortunate that in the place that I was in, it was, in large part Western training informed. And so a lot of the physicians who were there were either trained in the Western model or were themselves from, sort of developed nations that had had very good medical training. And so we were giving that level of training and care to our residents, the Nepali residents there. It was a training program, but that stood in really stark contrast to pretty much every other hospital in the nation. I mean, there were very few exceptions to that. And so a lot of the medical care was not remotely evidence-based. It was very expensive for patients without giving a lot of benefit. And then there's the next level up above even that, which is just the basic infrastructure of a nation. Are there roads that pregnant women can travel on to deliver in a safe setting when they're hemorrhaging? We would frequently get patients that would be peri-arrest, having hemorrhage for several days postpartum, and they would die, but within minutes of arrival. And so that would happen a lot. You see a lot of pretty tragic deaths, right? Like young mothers, young babies, children. It's a tough environment emotionally to work in. It's nice to have the benefit of a number of more senior missionaries who'd been through that for years, and they were able to give some good mentorship with that. But yeah, I don't know. I mean, in terms of the passion for why I do it, it's almost for me aesthetic. It's hard to verbalize. There's something very beautiful about, I enjoy traveling, and I enjoy the cognitive aspects of medicine, the sort of intellectual stimulation of a differential diagnosis, especially when you don't have a ton of things at your disposal. We didn't have a CT scanner. There was really no access to MRI services at all. So, you're having to do a lot of that diagnosis through really rigorous physical exams and good history taking. But I don't know, there's just something very beautiful, I think, about engaging across boundaries and across barriers. And for me, that's inherently valuable. I don't know that everybody sees it as such, but for me, it's pretty obvious. So I don't know if that answers your question. But
it does. Thank you. Could you tell me about sort of what you think has been your most impactful experience working in global health?
My single greatest? I'm working on a book actually right now that brings together a number of those experiences. What comes to mind, there's a story that I remember sharing with some elderly neighbors of my parents within a few weeks of my return from Nepal. And I remember at the time, I shared it with a great deal of emotion. It surprised me. It actually caught me off guard how emotional it was to talk about this. But for me, it's emblematic of so many cases that I saw. And the story was of a woman who was maybe in her late teens, early 20s. I forget the exact case details. But she had advanced kidney disease. She was sort of in acute kidney failure as a result of what we suspected was lupus, which is a type of autoimmune disorder, and has a range of severities, but at the most severe, it's certainly fatal. And in her case, it was rapidly progressing that way. And so she would need dialysis, and of course there was no dialysis where we were, and also would not have been able to afford even the transport to get to the nearest dialysis center, let alone long-term dialysis. It wouldn't have been practical. I mean, they didn't live near a center. It would have been a multiple day journey just to get there. So she essentially didn't have any options. Home dialysis, of course, not an option either. And so it was one of those things. Like, we were talking with the father, who was a farmer. He was a very poor, indigent Nepali farmer. We were in Nepali. We were speaking in the hallway, and which is really the only place you could ever conduct these conversations. And I was explaining to him that there really wasn't any hope for the daughter, that we would have to make her as comfortable as we could, but that there wasn't anything we could do to save her life. And of course, he was very emotional and really trying to maintain his composure. And then he said, if only I wasn't such a poor man, then this would be okay. Like, you could see that there was this weight on his shoulders of poverty, that there was the grief, of course, of losing his daughter. And it may have been his only daughter, I'm trying to think. But there was an additional burden, a significant burden added to that grief of being poor and of the shame that's involved with that. You could just see it on his face. And this feeling that if he was in a different situation, that this wouldn't be the case. And I felt like the one gift I could give him in that fairly dire situation was to reassure him that this is actually fatal no matter where you are, that in pretty much any country of the world, that you would still be facing the same odds of survival, which are very poor. So I don't know if that landed with him, but I do remember it stands out in my memory as one of these moments where it's just the sorts of challenges that patients are facing and the griefs that they are negotiating on a regular basis that really are so different and so far beyond what I, from my position of privilege, ever have to deal with. I could share tons of stories like that, some that are, that have more medical interest, some that have more of like the team dynamic aspect, but that's certainly one that stands out.
Thank you. Could you tell me sort of What conclusions have you drawn from your experiences working in global health?
That I know even less than I thought I did. I mean, my conclusions are going to be very unsatisfying, I think. I don't even know where to start with that one. I mean, I think, certainly the things that we have, like I'm grateful for the systems that we have, but I'm also aware that there are community benefits and strengths and just enormous levels of resilience and resourcefulness and creativity that I've witnessed in international settings far to a much greater extent than I've seen in America or in the developed West. And so I think it's easy to sort of see it as like better than or worse than, but actually there's things that we've lost or that we haven't, like whole aspects of character and just various strengths of individual and at the individual and community level that we just haven't needed to draw on because we have all these other supports in place. And so that's one thing that I would certainly want people to know. I think in terms of what is helpful for, say, the general American to know about global health, that's a big one. I think another is that so much of this is preventable, right? I mean, it's hard to know kind of how to approach it because a lot of it does have to do with inefficiencies and or corruption at high levels of government in some countries. And so those are big problems to fix. It's not a matter of throwing more money at it, but it is a matter of figuring out how to use those resources in a way that really builds capacity. And to do so under the guidance and direction of local nationals, people who know their country best and who know the systems best and are able to negotiate those systems, obviously, with much greater ease than we could. But also, I think you wouldn't want to undercut even their sense of self and their sense of agency. And so I think that's something that, in my experience, Americans are not very good at, is respecting that. So that's been a major take home for me, and something that I've also, in my various roles, leadership roles, have really tried to emphasize when people are trying to do short-term missions, to really go as a learner and to go with humility and to really try to, I guess, use this, what we call the ABCDs, the asset-based community development model, right? So not looking at what's wrong and what we can do to fix it, but really what's working well, and tell us what your vision is for it, and we'll help partner with you in that, to that end. So those would be some big ones. I'd certainly say go. Like I would do it again, even as hard as it was, and it was tough. I was there during the earthquakes that happened about 18 months into my time there. I was involved in some challenging relief efforts at the epicenter and some medical evacuation efforts that were not terribly well supported, and so were somewhat, to some degree, frightening, a little life-threatening at times. And so, that was all very stressful for sure. I'm very glad to be home. I wouldn't want to live abroad, but I think it still gave me a patience, a strength, and a sort of ability to endure a lot of stuff that people over the edge here. You can do that a lot more easily when you've been through, I think, a few years in a developing nation. So yeah, I don't know.
And then you mentioned that you are sort of working on this book. What would be sort of your hope that would be the takeaway for someone who maybe doesn't have much understanding of global health or the challenges facing healthcare worldwide?
It's a great question. I have to say it's actually a book that's more of a spiritual and travel memoir than it is about global health per se. I certainly obviously incorporate a lot of medical experiences into it, but I'm writing from a faith perspective that speaks a lot about that faith journey and what that was like, and how the experience of some of the hardships there, as well as some of the beauty, shaped my own sense of self and my own sense of God. And so that, I don't know, in terms of take homes, I think it's similar to what I was saying just now. Those would be most of it, I think, is really affirming the resilience of the people that I saw there, and just gratitude for how open-hearted they were and how willing they were to, I don't know, open their homes to me and help me to learn their language, and I don't know, joke, like sort of laugh with me and at me at my funny accent. I think that's actually another big thing too, is that it's a really healthy, if not a really difficult experience to be a cultural outsider, to go where your accent is difficult to understand when you're speaking Nepali, when you walk funny, you look funny, you dress funny, you don't know how to drink tea, like all these different things that, I mean, a friend of mine actually described it as like being a child again. Like you're almost learning from the very bare basics. You know, how do you even go to the bathroom sometimes? It's like a totally different style toilet. I mean, there's very, very basic, at a very basic level, some really big things you have to learn, and very humbling in that way. So that was an experience that made it really hard for those few years, right? Like trying to figure all that out and never quite feeling like I fit in, not really knowing, or not being known, I should say. Your reference group is kind of nothing, right? You're plucked out from one community and just plopped into this other place where nobody knows you. And so you don't have a very clear sense of self. It is one thing that I think people going into the global health world and crossing those boundaries should really be aware of, that it's a very disorienting experience, and it's very depersonalizing. I think people who go as couples, it might be a little different. So I went as a single, and so I really literally had nobody that knew me. I think it's a different experience when you go with families. Somebody, at least one person on earth, who can kind of remind you who you are when all of the signals around you are, you know, you obviously don't know how to like function in this culture, in this language, in this world, and must not be a very good doctor because all your patients are dying. You know, you sort of have these existential crises of sorts, identity crises of sorts. So, you know, again, shaping, helpful, not easy, but important to know. Yeah.
Okay, and then I think sort of last question is, within the field of global health, how can we best support you in pursuing your personal advocacy?
Well, thank you. I think giving me the opportunity to do advocacy has been a wonderful support, actually, and I appreciate Keith's support in that, to be honest. It's been wonderful, kind of out of the blue, to get this sort of an opportunity to even think at this level, and to have the opportunity to write and to speak a little bit more about that. So yeah, I think sending ideas and requests and promotional platforms, or platforms on which I can share ideas, is useful. Additional guidance maybe on how to do that would be helpful, if you have like a toolkit or any resources that help to know sort of how policy works, even like that's happening at a level. I don't get training in that as a physician, right? So a lot of it's what I'm gleaning from listening to NPR, for instance. That's about the only thing I can use as a resource. And so understanding how gears move at, you know, national and international levels, and why an op-ed, for instance, matters, and who's reading it, and why that would move the needle in any way. Those kinds of things would be helpful to know a little bit more, like to get a little bit of behind the curtain peek, I think, at what's going on. And even if you have like a conference or a workshop or a virtual conference, like a virtual half day or whatever, I'd be happy to block that. If I had plenty of advance notice, I'd be happy to block time for that. And, you know, even if there's resources that are already out there that you could funnel my way and toward other people that you're working with, that would be useful.
Okay, awesome. Is there anything sort of else that's popped into your head throughout our conversation? Anything you want to sort of add?
No, I'm curious to know a little bit about your professional interests and background, and kind of where you see yourself going with this as well.
So I personally am, I trained as a ballet dancer my whole life, went to college and majored in dance, and then got injured shortly after graduation, and had to sort of find a new career path. And I got involved in volunteering at a local hospital, and became really interested in medicine. So I went and I just finished up a couple months ago a post-bac program, and am now in the process of applying to medical school. So I'm very, very interested in global health and public health. So that's sort of my personal journey. And so it's been really nice having this opportunity to sort of get a broader perspective of how the pieces fit together. Because I think for me, as someone who's interested in medicine but hasn't really had that much experience, it does feel like there's this policy bit that goes on that I don't really have any knowledge of. So getting a little bit more involved with that has been a really interesting and I think useful experience.
Wonderful. That's fantastic. Oh, well, if you're thinking about public health and an MD program, definitely look at York Med. They have an MPH do concurrently.
Yeah.
And I do some admissions work for them. So I'd be happy to pass your admission along. So
thank you. Thank you. I appreciate that.
Yeah, of course. Well, best wishes to you. Yeah, that's exciting.
Thank you so much. All right. And then I don't know if we have to sort of stop the recording or if it just stops automatically when we leave the call.
I don't know, but I got a thing here that said that now I'm the host. So let me try pausing.